So, here's something I need you to hear if you're over 60 and popping B12 supplements daily. I get asked about this constantly at my practice. People tell me, "Doc, I've been religious about my B12. So why am I still exhausted? Why can't I think straight? Why do I feel dizzy? Or why are my hands and feet going numb?" Just the other day, a 68-year-old guy came in with the exact same concerns. He'd been taking his B12 like clockwork for over 7 years. Every single test came back looking fine, but he was losing steam, feeling unsteady on his feet, and his memory was slipping away bit by bit. Here's what blew his mind. He wasn't actually deficient in B12. He was just taking it completely wrong. Turns out there's new research pointing to a super common mistake with B12, especially for folks over 60, that can totally block your body from using it properly and quietly mess up your nerve function. I'm Dr. Emily Carter, and what I want to do here is break down that mistake, explain why most doctors miss it, and show you the right way to take B12 so it actually does what it's supposed to: protect your brain, support your nerves, and keep your energy up long term. Quick favor before we get rolling. Drop a comment with your age and location. Are you taking B12 but still feeling wiped out, foggy, or numb? Let me know because your story could really help someone else here. And go ahead and subscribe if you haven't yet. I put out helpful health info like this every week, specifically for people thriving past 60. Here's what most people think. If your blood work shows normal B12, you're good to go. But when you're over 60, that's usually not the whole story. B12 is crucial stuff. It keeps your nerves working, your brain sharp, your red blood cells healthy, and your energy metabolism humming along. When your body can't actually use the B12 you're taking, your nerves start malfunctioning. That's why the early warning signs include tingling fingers and toes, balance issues, constant tiredness, memory problems, and that annoying brain fog. Here's the thing. As you get older, your ability to absorb B12 takes a nosedive. By 60, more than half of us have lower stomach acid than we used to. And stomach acid? That's what pulls B12 out of your food and supplements. Without enough of it, the B12 just slides right through your system without doing anything. I saw this firsthand with Margaret, one of my patients who's 71. She kept complaining about burning feet and constant dizziness. Her doctor ran a B12 test, and it came back at 420, totally normal range. They told her everything was fine, but her symptoms just kept getting worse. What people don't get is that a standard B12 blood test doesn't tell you how much is actually getting into your cells. It just shows what's floating around in your blood. For older adults, your blood levels can look perfectly fine while your nerves are literally starving for B12. That's why so many seniors take it for years without feeling any better. Now here's where the first big mistake happens. Most older folks take a regular B12 tablet and wash it down with water, assuming their body will soak it up like any other vitamin. But after 60, that approach usually fails. To absorb B12 properly, you need something called intrinsic factor, a protein your stomach makes. As you age, you produce less of it. Without intrinsic factor, those B12 pills you're swallowing barely get absorbed at all. And this isn't some rare condition. It's incredibly widespread. Remember that 68-year-old I mentioned earlier? He was doing everything by the book. Same time every morning, same dose, same brand. But his nerves were still falling apart. When we switched up the form of B12 he was taking, not the amount, just the type, his symptoms started turning around within a few weeks. That's why the kind of B12 you take matters just as much as how much you're taking. If this is making sense, hit that like button. It genuinely helps the channel reach more people who need this info. All right, let's talk about the second mistake, and this one's everywhere. Most people are taking the wrong type of B12. Walk down any supplement aisle and you'll see the same name over and over, cyanocobalamin. It's cheap, it stays shelf-stable, and it's the least helpful form for older adults. Cyanocobalamin is synthetic. Your body has to convert it into active B12 before it can actually use it. That conversion needs a healthy liver, the right enzymes, and good antioxidant levels. For people over 60, that whole process tends to slow way down. Take Robert, for example. 72 years old, had been on cyanocobalamin for years. His levels looked okay on paper, but he still had numb fingers and trouble walking. We switched him over to methylcobalamin, which is an active form your body can use right away. The difference was obvious. His balance got better within a month. After 3 months, the numbness dropped significantly. Studies show that active forms like methylcobalamin and adenosylcobalamin get absorbed and used way more efficiently in older people. Then there's the whole dosage timing issue. Lots of seniors take B12 once in the morning and think that covers them. But B12 dissolves in water, so it leaves your bloodstream pretty quickly. If you already have absorption problems, one daily dose might not keep your levels steady enough for nerve repair. There's also confusion about injections. Some people think B12 shots are the only real solution. Truth is, injections help when you're severely deficient, but they're not always needed. High-quality sublingual B12, the kind you let dissolve under your tongue, can work just as well for a lot of seniors when taken correctly. Sublingual forms skip the whole stomach and intrinsic factor situation entirely, absorbing straight through the tissues in your mouth. That's huge if you have low stomach acid or digestive troubles. Bottom line, if you're over 60, swallowing a standard B12 tablet might make your lab results look fine, but it might not be doing anything for your nerves. Now we get to the third mistake. And this one catches people off guard because it's not about dose or type. It's about timing and consistency. A lot of folks only take B12 when they're feeling wiped out. They skip days, they stop when things improve, then restart weeks later. But nerve tissue doesn't heal like that. B12 isn't a shot of caffeine. It's a repair nutrient. Your nerves need a consistent daily supply to rebuild myelin, that protective coating around your nerve fibers. When you take it on and off, you're interrupting the whole repair process. I saw this with Elaine, 70 years old. She'd only take B12 on days when she felt exhausted. Yeah, she'd feel a bit better those days. But the numbness, balance problems, and memory issues never budged. Once she started taking it every single day without skipping, her symptoms stabilized. 2 months in, the tingling stopped getting worse. 4 months later, her balance improved noticeably. Another thing people overlook is taking B12 at the wrong time. Some seniors take it right before bed. For some, that messes with sleep. Poor sleep spikes your cortisol, increases inflammation, and slows down nerve repair. For most older adults, the sweet spot is earlier in the day, morning or early afternoon. That supports your energy and nerve function without keeping you up at night. Hydration matters more than you'd think, too. B12 works inside cells that depend on proper fluid balance. Chronic mild dehydration, which is super common in older adults, slows down how nutrients get transported to nerve tissue. If you're taking B12 but barely drinking water, you're limiting your results. And here's another wrinkle. Many seniors are on medications that mess with B12 absorption or how it works. Acid blockers, metformin, certain antibiotics, these all interfere. I'm not saying ditch your meds, but you do need to adjust how you're supporting your B12 levels. By now, you might be realizing something important. Most seniors aren't doing just one thing wrong. They're doing several small things wrong all at once. Each mistake chips away at the benefit a little. Together, they can completely wipe out any effect from the B12 you're taking. So let me walk you through the right approach for seniors. This is exactly what I do with my own patients over 60. First up, the form. For most older adults, your best bet is methylcobalamin, or a mix of methylcobalamin and adenosylcobalamin. These are active forms your body can use immediately. No conversion needed. Don't rely only on cyanocobalamin, especially if you've got nerve symptoms. Second, how you take it matters. If you're over 60, swallowing a regular tablet often isn't enough. Sublingual B12, the kind you let melt under your tongue, gets around a lot of absorption issues. This change alone can make a huge difference. Third, dosage. For nerve and brain support in seniors, low doses usually don't cut it. Most older adults need higher amounts to get past absorption barriers. A typical effective range is 1,000 to 2,000 micrograms a day. Some people need more at first, then can back off to a maintenance dose. Don't worry, this isn't dangerous. B12 is water-soluble, so your body just pees out the extra. Fourth, consistency. Take it every day, not sometimes, not just when you're tired. Nerve repair is gradual. Symptoms typically improve slowly over weeks or months, not overnight. Fifth, timing. For most seniors, take it in the morning or early afternoon. This boosts daytime energy and cuts down on sleep issues. If B12 makes you feel wired, definitely skip the late-night dose. Sixth, supporting nutrients. B12 doesn't work in isolation. You often need folate and vitamin B6 for full nerve support too. Just be careful with high-dose folic acid. Natural folate or methylfolate usually works better. Seventh, tracking progress. Don't judge success just by blood tests. Pay attention to how you actually feel. Are your hands less numb? Is your balance better? Is your thinking clearer? Those changes matter way more than a number on a lab printout. I had a 75-year-old patient who followed this exact plan. After 3 months, her lab numbers barely budged, but her walking improved dramatically, she stopped falling, and her confidence came back. That's real success. Now here's something critical to understand. B12 is powerful, but it's not a miracle cure. There are situations where B12 alone won't completely fix your symptoms. One big issue is long-term nerve damage. If you've had nerve compression, spinal problems, or diabetes for many years, B12 can help repair things, but it can't reverse major structural damage overnight. Blood sugar control is another overlooked factor. High blood sugar directly damages nerves. In seniors with pre-diabetes or diabetes, nerve symptoms might stick around unless glucose levels get addressed. Inflammation is another silent problem. Chronic inflammation messes with nerve signals and nutrient delivery. Poor sleep, ongoing stress, and sitting around all day. All of these raise inflammatory markers. If you ignore these issues, your B12 has to work twice as hard and delivers half the benefit. There's also the possibility of misdiagnosis. Not all numbness, tingling, or weakness comes from B12 deficiency. Things like cervical spine compression, carpal tunnel, and peripheral neuropathy from other causes can look just like B12-related symptoms. That's why ongoing or worsening symptoms should always get checked out by a medical professional. Don't assume more supplements will fix everything. Quick story. A 73-year-old guy came to me frustrated. He doubled his B12 dose on his own after Googling around. Nothing improved. Further testing showed he had spinal stenosis. His nerves were being physically pinched. No amount of B12 could touch that. Once we got the right diagnosis and treatment going, his B12 supplementation became helpful instead of frustrating. Let me pull everything together into a simple action plan. If you're over 60 and taking B12, here's what really matters. First, quit obsessing over lab numbers alone. A normal B12 blood level doesn't guarantee healthy nerves or sharp brain function. Focus on how you feel and how your body responds over time. Second, use the right form. Go with an active type like methylcobalamin or a combo of methylcobalamin and adenosylcobalamin. These don't need conversion and work better in older bodies. Third, pick the right delivery method. If you're over 60, don't rely only on swallowed tablets. Sublingual B12 lets you absorb it without needing stomach acid or intrinsic factor. Fourth, take an effective dose. For most seniors, 1,000 to 2,000 micrograms daily is a solid starting point. Some folks need more initially, then less for maintenance. Check with your doctor if you're unsure. Fifth, stay consistent. Take it daily. Nerve repair is a slow, steady process. Skipping doses sets you back. Sixth, time it right. Morning or early afternoon is best for most people. Skip the late-night dose if it keeps you awake. 7th, support the whole process. Drink enough water, keep your blood sugar in check, get decent sleep, and manage stress. These factors decide whether B12 can actually get to your nerves and brain. 8th, know when to dig deeper. If symptoms keep getting worse, don't assume B12 is the whole answer. Get properly evaluated for nerve compression, metabolic problems, or other root causes. Let me be crystal clear. When taken correctly, B12 can protect nerves, support memory, and boost energy in many seniors. Taken the wrong way, it seems to do absolutely nothing. The difference isn't random, it's understanding. Before we wrap up, one last story. A woman in her early 70s came to see me after years of thinking B12 just didn't work for her. When we went through her routine, nothing she was doing was technically wrong, but nothing was quite right either. Wrong form, swallowing a tablet her body couldn't absorb well, taking it inconsistently and only looking at lab numbers. She changed just a few things: the form, the delivery method, the consistency. 3 months later, she told me something I'll always remember. I feel steady again. I trust my feet when I walk. I don't lose my words mid-sentence anymore. That's the difference between taking a supplement and actually using it right. If you're over 60, B12 isn't optional, but how you take it matters more than most people think. I'd encourage you to look at your current routine tonight. Ask yourself one simple question. Is this actually helping my nerves and brain, or am I just going through the motions? Before you take off, drop a comment with your age and location. Tell me what kind of B12 you're taking and what changes you're planning to make. I read every single comment and genuinely love hearing from this community. If this video cleared something up for you, share it with someone you care about. Too many seniors are taking B12 the wrong way without realizing it. Thanks for watching. Don't forget to subscribe for more health tips made specifically for seniors. Remember, B12 is essential after 60, but only when you take it the right way.